Our next presenter, who I'm excited to introduce. I've been in touch with this practitioner for, I think several years now. And I think it was today that we actually finally met in person, which is wonderful. So it's been quite a pleasure. It's been wonderful for me. So our next speaker graduated from the University of California at San Francisco Medical School and completed a family practice residency in Santa Rosa, California, where she also served as the chief resident. She moved to the Rogue Valley over 30 years ago as the first medical director of Clinica. She is an experienced practitioner and teacher of classical homeopathy, and for the last 15 years, she has had an integrative practice, approaching medical complaints with lifestyle solutions. So definitely someone you want to be in touch with. She has had a particular interest in Alzheimer's disease and has trained with Dr. Dale Bredesen in 2016. Please help me give a warm welcome to my good friend and dear colleague, Dr. Deborah Gordon.
Good still morning to all of you. It's great to be here in a room of people focused on issues of health, and I thank Dr. Gala and his crew for putting this together. So when I went to medical school 40 years ago, there was a word that we never heard while I was there, and that word was health. We instead focused on disease. And it was in my internship that a lecturer came to speak to us about the genetic associations, and his topic that day was cancer. And in response to one of his questions, I raised my hand and I said, yes, my grandmother had breast cancer in her 70s, and my mother had breast cancer in her 40s. And he stopped and he lowered his glasses and he looked at me and he said, you'll get it even younger than they did. So not only was he rude, but he was actually very generous to me because he got me started on a field of genetics, which did not come up when I was in medical school. And more than that, he introduced me to the field of epigenetics because I devoted myself to not getting breast cancer. And my success in that, approaching my grandmother's age, but not way past my mother's age. My success in that started that day. And so I have a particular interest in the field of epigenetics, and one place where it's very relevant is the area of Alzheimer's disease. So I'm sure everyone's aware that Alzheimer's disease is one of the leading causes of dementia, it's about 70% of all the causes of dementia. And over the age of 65, it affects 1 in 9 of us. That is, unless you have the bad genes for it. So there's a specific gene called the ApoE gene, and if you have the ApoE4 variety, your risk goes up to 1 in 3. You're the red tree. And it was not too long ago that if someone had asked me, should I find out my genetics? I would have said absolutely not, because I don't think worrying is going to help you prevent it, and medicine has nothing else to offer you. Boy, that was a while ago, wasn't it? Because now we understand really a lot of what goes into the genetics of ApoE4 and how it can be reversed, how those risk factors can be reversed. But you have to ask yourself, to get to what those risk factors are, why on earth did we come up with a gene that increases our risk for Alzheimer's disease? So as I said, we didn't cover genetics in medical school, but I know enough to know that a gene arises and persists because it gives you an advantage if you have that gene. So what on earth could be the advantage of the ApoE4 gene? And this is a timeline, and it goes back 5 million years ago to when the ApoE gene first appeared. And it appeared as an ApoE4. And at that time, our pre-human ancestors came down out of the trees and started living together in camps on the ground. That actually gave them several advantages. They were able to cooperate. We began to develop things like culture. And they switched from eating trees and the leaves and fruits of trees to killing animals and getting the highly nutritious proteins and amino acids and other things that come from meat and enable them to be humans. But there were several problems with that lifestyle. They lived very close together. the sanitary system did not work at all. They didn't even have outhouses. And oftentimes they were eating meat that was a couple days old, and that meat, so you've probably heard of the term grass-fed meat. And grass-fed meat is leaner than grain-fed meat, and wild meat is the leanest of them all. And so these pre-human ancestors needed to resist the less than sanitary conditions they were living in, and they needed to be really good at absorbing fat from the meat that they were eating. Before 5 million years ago, when we lived in trees, there's something that we shared with cows. I love to think this about cows. So cows somehow eat green grass and give us butter and cream and marbled steaks. How on earth do they do that from green grass? Their long intestines ferment the green grass, enable them to make a lot of fatty acids to fuel our plates and their brains. Our pre-human ancestors had bigger brains from eating the meat. They needed even more fatty fuel. And so the ApoE4 gene conferred upon them higher blood levels of cholesterol, so they could absorb the fat from the meat they were eating, enough so that our cholesterol, even the bad cholesterol, fuels our immune system and is intrinsic part of our brain, so it was really helpful to them. They also developed a stronger inflammatory response with the ApoE4 gene to infections, toxins, and injury. Interestingly, ApoE4 then and now makes you smarter in youth. And in those days, people weren't living, even the people that survived childbirth or trauma of youth, were not living as long as we are now. And now these problems of higher cholesterol, higher bad cholesterol, and lots of inflammation are the perfect storm for Alzheimer's disease. There are actually, though, some populations that have a high rate of this ApoE4 gene and no incidence of Alzheimer's disease. They figured out their way around these two factors of Alzheimer's disease. But in this country, for most of us, if you have the ApoE4 gene, it goes from a risk in 1 in 9 that we all have just sitting here. 15% of us are ApoE4, and your risk is 1 in 3. But here's the thing. 3 years ago now, Dr. Dale Bredesen of Northern California published the first study where he took 10 people and applied a lifestyle program to them, the kind of things that you're learning about today or that you already know about, with a little more detail and a little more intensiveness, and he reversed Alzheimer's in 9 out of 10 people. He brought back their memory. He brought back their ability to remember their locker combination. A woman was able to take she had a little tag on her dashboard that said, "Remember to drive the car on the right side of the road." Gone. The radiologist called and said, we did a follow-up MRI on your patient's brains, and I'm sorry. Well, what are you sorry for? Well, all of our first readings must have been wrong. Well, what do you mean? He says, well, their brains are larger now, and we've never seen that. So it is possible to do it, to reverse Alzheimer's, and you can do it. You're here today, you have the interest and the commitment to make a better life for yourself, and all the things that are needed to prevent or reverse Alzheimer's can be done by anybody. With a little bit of attention, the right kind of support. Boy, I want a health coach in my clinic, and let me talk to you after this setting. And it is really doable. And it's things you know. You need to exercise your body and your brain, and exercise is very particular to prevent or reverse Alzheimer's. Not only do you stay active, we can all go for a walk at lunchtime, but a couple times a week you should do something very intense and bring up your heart rate high. And you should also get some coaching doing it, but lift some heavy weights. You need to exercise your brain as well, so stay curious and challenge your brain. There's some online programs, and specifically Brain HQ is the one that has been documented to reverse Alzheimer's. And if you're going to work something out, you need to relax it and allow it to recover, whether it's body or brain. There's a particular healthy diet, a particular kind of healthy diet for Alzheimer's disease. It involves lots of vegetables. It involves as much fish as meat, and that meat should be grass-fed, as should your dairy. There are healthy fats, even though people with ApoE4 have a tendency to have higher cholesterol. That can be managed and can be healthy if they're eating healthy fats, including the one shown and the one that's been mentioned by every speaker, I think, today, fish and fish oil. Big proponent of those. And you can use some dairy fat. The point of all of this is to minimize inflammation. And so things like seeing your dentist and keeping your dental health optimal, having a diet that's low in sugar and grains and perhaps even absent in them. If you've been eating that way, you go to someone's house who's made a cookie. This happened to me this week. I tasted the cookie. It nearly made me nauseated. It was too sweet. Fasting overnight for 13 hours, and my favorite thing is fasting between meals. If you're hungry at 4 o'clock, eat, but tomorrow eat a bigger lunch so you're not snacking between meals. And check how your levels of inflammation are. There's some supplements that are specific for the brain, and everyone with ApoE4 should be taking resveratrol in particular. In addition, curcumin, other ones you've heard of, ashwagandha, not only optimizes your brain function, but it lowers that so-called bad cholesterol. And anything that's been studied, and you can read about it in anti-aging magazines, that's called a nootropic, that specifically enhances brain function. I took a double dose this morning, so I'd be able to talk fast enough, and I'm out of time now. But there's common vitamins that you already know about, and specifically methylated B vitamins, optimized to keep your homocysteine not at what doctors call, that shouldn't say normalized, that should say optimized. I'm not interested in you being normal. I'm interested in you being optimal, even if you're a little abnormal. Just a setting on the dryer is normal. I like that. If you're over 50, you should be taking CoQ10 as ubiquinol and some array of different things that can be antioxidants. Dr. Bredesen said with Alzheimer's disease, you have a roof that's leaky through 36 holes. You have to plug about 25 of them, and they're different for everyone. I'm a big believer in hormone replacement. Estradiol receptors in the brain have to be properly fed. How many women have I had who said, fountain of youth, I don't care if I've had breast cancer, and in fact it does reduce your risk of subsequent breast cancer, but to optimize their levels of estradiol. And for everyone, testosterone and vitamin D, of course, looks like a supplement, but it is a hormone. Of course, now you're going to ask me, how do I get tested for ApoE4? If you just walk into the lab and ask for the blood test, it's spendy. Insurance varies, but most of them will cover it one time in your lifetime. It's the one thing smart about insurance companies. They know that your genetics don't change. It's about the only thing good about them, I can say. You can get testing through 23andMe, who have now started telling people what their ApoE4 status is. They only get that reading in about 85% of their clients, so I go ahead and get blood tests when needed. If your practitioner is involved at all with specialty labs like Genova Diagnostics or Cleveland Heart Labs, we can get it for $25 or $30. So thank you for coming on this whirlwind of ApoE4 with me. There's lots more on my website about ApoE4 and Alzheimer's and lots of other health things. So I invite you to join me there.
So let's do one question. Is it okay if we put you on the spot?
I'd love to.
Awesome. So let's do one question. Go ahead and raise your hand. I think I saw the first one right here. Do you have a mic?
What are the odds? My father was in the early stages of Alzheimer's when he died. What are the odds that his children have it?
The gene is passed on so it's an autosomal dominant disease, meaning gene. So he probably had an ApoE3 and an ApoE4. 50% of his children are going to have that ApoE4. Yeah, so so with Mendelian, there's probably 2 of you that have that gene. And if you have one copy of the gene, your chances are 1 in 3 of having Alzheimer's disease. And what I meant to say is you have 2 copies of the gene, your chances are 11 out of 12. The woman who took the little slip off her dashboard was speaking to us at the conference, presenting really eloquently off her iPad, which I didn't even know you could do. She's an ApoE4.
So the thing I would like to impress upon you, how many people have heard that, there's not much you can do for Alzheimer's or Parkinson's? So to me, it's these types of researchers and scientists and colleagues and people like Dr. Gordon and these types of events where, raise your hand if you've learned something new here today already. So these are the kind of things that we're talking about. There's things you don't even know that you don't even know you don't know. And that's where the changes come from. So I know, and probably, I don't know if what you've seen in your case, but similarly, we've had people that have reversed Parkinson's symptoms or had their memory improved. So I know, and I'm sure you could probably speak to that, but we've had numerous people that do what you're talking about and can make substantial changes. So I would say that for me, I listen to that and I get a tremendous amount of hope and optimism that our bodies can heal much more than we've been led to believe.
That's right. So 9 out of 10 of his subjects in his first trial healed, and the 10th was the most advanced, but some of the 9 were pretty advanced. The woman who took the little note off her dashboard had asked her neurologist, she wanted to reverse her Alzheimer's, which she's finally figured. He said, good luck with that. So now she's making a movie called Good Luck with That. Thank you all.
Thank you.
Thank you.
So, and so that's another thing that I hear is people will come into me and they'll say, yeah, but Dr. Gala, and I'll say, yeah, do you want to lose weight? You want to reverse your diabetes, reverse your neuropathy, work towards reversing your Alzheimer's, et cetera? And they say, yeah, but my doctor said there's nothing that they can do for it. Or they say there's nothing that we can do. And it comes across as though their physician is talking collectively for the entire world. So the thing that I would encourage you, and I'm not trying to say anything bad about any physicians, because just like I don't know any physician that knows everything, just like I don't know everything, of course, is that if a physician tells you something and it goes contrary to what you want to achieve, meaning let's say it's Alzheimer's or lose weight or balance your hormones, and they say, oh, there's nothing that we can do for that, realize what that person is really saying is there's nothing that I can do for that. And don't stop searching. Because just like we said, like Dr. Gordon was mentioning with the insurance, healthcare today is really more sick care. And if you want to get, your insurance will most likely cover your medications long before they'll cover you going out and buying a salad. So they'll pay for drugs and surgery long before they'll pay for other things. So the trap I would encourage you to avoid is going into your physician, and if your physician suggests something, the next thing out of your mouth is saying, well, will my insurance cover it? Because if that's, the thing I see that prevents people from getting successful is if they say, well, yeah, but does my insurance cover it? Right then you've put a middleman in between your doctor and yourself for getting you really what you want, because now you've just held yourself hostage and everything has to be filtered through the insurance company. Do you know the average physician spends about 20 to 30% of their time with patients, and the other 60 to 70% of their time doing chart notes just to satisfy insurance billings to get paid. So 30% of healthcare right now is actually focused on the patient. The other 70% is to admin duties, meaning put it in chart notes so that they can send it to the insurance so that they can get paid, and then argue when the insurance comes back. If you ever get a form that the insurance said, well, we still need more time to review your case, give us another 30 days and we'll let you know, or something like that. And the problem is it just delays, and we have this huge machine of a system that's failing people left and right, unfortunately.